Just to set the Meet the Press in its context today, there are 4 big stories. Story number 1 is that up to 54,000 healthcare personnel being recruited by the end of 2019. Second is that there's a new logistics management information system which will deliver better management of healthcare supplies. Third is that we are achieving significant success in high-burden diseases. The detail will be out. And finally, health insurance is revamped. He will provide details. So without further talk, I want to invite the Minister responsible for health and Member of Parliament for Doma Central, the Honorable Kweku Agyeman, to lead us in this presentation. Minister.
Now, what do we want to achieve? As we sit here, we are part of the globe. And our president is championing a lot of things on the global platform. So as part of our new vision and our new mandate, we want to achieve what the world is calling universal health coverage, leaving no one behind. What does this mean for Ghana? All people in our country, Ghana, will have timely access to high-quality health services, irrespective of ability to pay at the point of use and irrespective of where they live, their location. And let me mention that our president is a co-chair of the SDGs, and that is why our focus is now seriously being put on how we can achieve the health-related SDGs. Again, our president is one of the 3 presidents of the world who signed to trigger a global action plan to be made for the achievement of UHC 2030 Compact. This action plan, after they put a petition to WHO, has now been developed with support from partners, and that is going to be launched at the next UN General Assembly. Our president has played a very significant role in that. We are strategizing to look at health as follows. We are refocusing government primary role from sole service provider towards partnering with other service providers, including the private sector. We are investing in health and strengthening health systems. We are adopting people-centered approach to services and not disease-centered approach. We are focusing on comprehensive leveraging the potential of traditional and alternative medicine as a complement to health service delivery. And we are redesigning and reviewing the current health architecture, our systems, our environment, and our people or our professionals. We aim to improve 3 areas: access, financial risk protection, and quality of service. On service delivery, we're looking at quality of care, as well as looking at preventive health services that will include childhood immunization, cholera and other epidemics, meningitis, TB control, HIV and malaria. And non-communicable diseases this time around is being given some serious emphasis. Quality governance structures has been strengthened to coordinate implementation of all quality initiatives in the sector. A national healthcare quality strategy has been developed for 2017-2021 that we are implementing now to guide our process. Emphasis on various tools to ensure accountability and responsiveness. For example, our community scorecard to empower communities to take active part in the monitoring of health services in their communities by giving feedback to health authorities. So we've designed a template that will allow community people to have an input as to how they see our service wherever they live. And we pick that one, analyze it, and look at where the community feels we are not doing well and how we find ourselves and what strategies we can use to improve on service delivery. For preventive services, Ghana's national immunization coverage has improved over the years. Coverage for 2018 was peaked at 97.47%, meaning that we immunizing almost all children in our country, and this is a significant achievement. All our childhood vaccine requirements for 2019 has been secured, so we are not going to have any shortage of any vaccine in course of this year. What are the achievements for immunization? Polio, no case reported in Ghana since 2008, and we continue to monitor to ensure that we don't have challenges with polio. Measles, no documented measles associated death in Ghana since 2003. And I'm proud to even say that these days, if we are not careful, soon, some of our newly qualified medical doctors might not be able to diagnose measles because they are not seeing measles in any of our facilities any longer. Reduction in diarrhea since introduction of rotavirus vaccine in 2012. So that disease in children, where they will run and even run blood and things like that through the vaccine rotavirus introduction, that is not being seen any longer. No meningitis outbreak since this year, 2019, a near elimination of yellow fever. That is what we have achieved with preventive services. And no new cholera outbreak reported since 2017 to date. So we are on course. Containing meningitis outbreaks, the epidemic belt is extending southwards. And our epidemic preparedness plan takes this into consideration. So we are not only concentrating on meningitis epidemics in the north, but we're also extending the way the disease is driving us. No case of meningitis attributable to meningococcal A bacterium has been detected after meningococcal A conjugate campaign in 2012. So there again, we are making progress. Tuberculosis control. We've intensified case finding. Case finding has been extended. Intensified case finding has been extended to 113 facilities. And our goal is to reach 216 facilities nationwide. GeneXpert mobile x-rays have been deployed, and we are using this for early detection of tuberculosis in very seriously endemic areas that we have identified. A total of 14,200 of all forms of TB were detected in 2018 out of a targeted 19,764. So there again, we are making significant progress. Treatment success rate for 2018 was very good, and this stood at 85%. This is commensurate to international standards. Still on preventive services, HIV/AIDS prevention and control. In 2014, the Joint United Nations Program of HIV/AIDS and partners launched the 90-90-90 targets with the aim to diagnose 90% of all HIV-positive persons, provide antiretroviral therapy for 90% of those diagnosed, and achieve viral suppression for 90% of those treated by 2030. This is a big target across the globe, and we'll soon see how we are faring. We should be testing, we should be treating, and we should make sure that we are achieving success by doing viral suppression with the type of treatment that we are giving. This initiative, the 90-90-90, has become a key strategy to end the epidemic by 2030. Let us look at where Ghana stands. In 2016, the first 90 were at 40%. That is for testing. For treatment, we are at 39%, and for viral suppression, 58%. So we were nowhere close to the 90-90-90. 2017, we moved to 62%, 45%, 51%. 2018 December, our statistics indicate 69% for testing, 38% for treatment, and 66% for viral load suppression. We have had challenges with procurement of supplies for treatment, and we have identified this area as an area that we need to improve. So that has become a challenge for us, and we are now adopting a new roadmap to tackle the HIV/AIDS challenge. And we believe that by 2020, we will change these indicators and move closer to achieving the 90-90-90 by 2020. Malaria control. The ministry's strategy for malaria remains early detection and treatment of malaria cases, distribution of the long-lasting insecticidal nets to at-risk populations and targeted groups. And over 15.5 million of these nets were distributed through mass campaigns in 2018. Let us look at outcomes. Number of deaths attributed to malaria in Ghana 2018. If you have a graph in there, that will show how we are faring. We've moved down from 2,037 deaths in 2015, close to now 428 in 2018. So gradually, our strategies and our preparedness and our efficiency in combating malaria is achieving tremendous success. In April, we made history with Ghana being the second country in the world after Malawi to pilot the malaria vaccine. Research has indicated that if the world wants to actually take away malaria from our disease burden list, we need to begin to do things that will prevent us getting malaria. The nets are working though, but we still have challenges. So we are now piloting implementation of malaria vaccine in our country. There are only 3 countries now in Africa that are that's where we are piloting now, and that's why we see Ghana is behind Malawi. They started before we did, and Kenya is following the case of Ghana. We are piloting in 6 regions, and this was commenced on 1st of May 2019. Annually, we target to actually vaccinate between 120 and 150,000 children for the next 3 years. This is part of our interventions to reduce the burden of malaria in Ghana. Non-communicable diseases control. Cancer treatment guidelines has been developed. The Cape Coast Registry, Cancer Registry has been commissioned and work has started in addition to Komfo Teaching Hospital and Kwelebu Teaching Hospital. We want to actually identify where we have cancers and get a register of all those who have cancers to help our research and to help us find new strategies to see how we can combat non-communicable diseases, especially cancer. We have also elevated our health promotion to provide appropriate information on health and wellness. The ministry is supporting the creation of wellness centers in all our facilities, and that is a policy that Ghana Health Service is championing. We have sent instructions that all facilities, at least at the district level, should begin to create wellness centers for people to get in to see how best we can get ourselves educated and practice how we can stay away from non-communicable disease lifestyles. Traditional medicine. We have successfully integrated 35 herbal medicines in selected health facilities. So we have now medical officers who specialize in herbal medicine, and we are attaching them to some of our facilities so that when you go and you want an option of herbal medication, you can attend to that clinic within the Orthodox Center. A typical example is in Dodua. When you go, you have the traditional Orthodox medicine we knew in Ghana, and then an outlet for herbal medication. They will do diagnosis and all that. So that is, if that is the way you want to go, you try and get there. But the two are collaborating to find out where one is failing and where one can support the other. Maternal health outcomes. Maternal mortality ratios, you can see again from the graph how we are faring. We are now doing 127.3%. So averagely 127 out of 100,000 live births. These indicators, I think I will leave it out and move on. What is our National Action Plan for Health Security? This has been developed following the joint JEE for core capacity development for international health regulation implementation. This will soon be launched. There is a need for higher-level interministerial advocacy meetings, and soon we will introduce 275 ambulances across the country to help our emergency preparedness and the way we attach significance to health security. Supply chain reforms. Let me take you back a little bit and mention the Central Medical Stores disaster, where almost all commodities that were housing for health service delivery got banned. After that, we did an audit, and some of our donors had commodities in there. Global Fund has become a big stakeholder in supporting our fight for malaria, HIV, AIDS, tuberculosis. They alone lost close to $27 million in commodities that got banned, nets and other things. By their rules, $27 million should have been recovered from our country. Negotiations and they themselves, looking at reality, indicated that there was no way Ghana could pay back $27 million. So the ministry agreed with them to improve on our supply chain. A master plan was developed that was turned into an agreement between Ghana Ministry of Health and Global Fund. And in there, we identified 4 milestones, such that if you could develop and implement those areas that will significantly improve on our supply chain, they will give us relief of those monies, like HIPIC. So do this, and we'll forgive you this amount. I'm proud to announce that as I stand here, we have virtually completed implementing the entire milestones as we met in the ministry in 2017. Logistic Management Information System virtually completed now, close to about 95% complete. We are getting close to deploying this into our central medical stores across the regions. We're doing what we call the last mile distribution, such that we're carrying our commodities to the last user. So the last ship compound wouldn't come to collect drugs from any of our regional stores. We're carrying them to them. We have done what we call freeway contracting. We piloted last year, and looks like it's working. We have identified deficiencies, and we'll soon launch another tender process to go the second time. The strategy in there is to stabilize prices of our commodities, special medicines. We selected about 54 medicines, and we did tender competitively to select suppliers for these 54, so that we lock them in for 1 whole year without price changes, until something fends beyond control of us and the suppliers happen that we can't have control over. Then we'll sit and negotiate for new prices to be done. So that is where we are trying to move to ensure that we stabilize prices and make everybody be able to access medicines that are prescribed for them. Then we have developed our warehousing strategy that we have been running today to support our challenges. The drone situation has become part of the supply chain management issue to actually even support us and give us a platform when we have emergencies. So that has become part of our emergency preparedness for us. So we use drones to do some of the normal supplies to areas that we cannot easily reach. But anytime there is an emergency, we now have a platform that will support us. We launched the first drone center about 2 weeks now in the Eastern region. There are 3 more to be done in the first phase of the drone technology. That will send our supplies faster, areas that we can't easily reach, but that is also part of our last mile distribution effort to make sure that drugs get to where they should go. Zipline is doing this facility for us, and we are buying service from that company that has put up the platform. Our antimicrobial policy was developed and launched sometime 2018, and we have started implementing the components of antimicrobial policy in there. What we want to do is to ensure that we don't continue to abuse antibiotics in our country, because we are getting resistance from several diseases on antibiotics that we administer. And research has identified that we are either overproducing, we are contaminating, we are polluting, and therefore the microbes are getting resistance from all these areas. So we need to control the environment and our use of these microbes. Again, we are aiming at digitizing the health sector, and the ministry is developing a national data center and electronic medical records for the health sector. What we want to do is that we are taking computers across the entire operations of all our facilities in the country. So when you get to the OPD, you'll be registered on the system, and wherever you move within the hospital, you will carry no folder. So from when you are registered, they won't give you a card to enter the consulting room. You go and meet a doctor there, whether an iPad or a laptop or desktop, and then he will open a folder for you. And that folder becomes your folder for the rest of your life in all facilities when you're able to complete this process. So if you move from Solpong to Konfanochi, you won't carry any folder. You go there and your ID card for health will be entered, and the doctor in Konfanoche will assess all your medical records from childhood where you lived in Widimba or Sopon in Konfanoche. This process will also take us through a module that will do biosurveillance, such that if within a very short period of time we are getting cholera cases from a particular area in the country, it will trigger automatically to our emergency preparedness center, and we'll begin to trigger our things to work on our emergency issues. That system has been piloted. We have linked 28 facilities in Central Region since last year, and we are now working in deploying the facility in Konfanoche. And by the end of this month, early next month, we will launch our deployment in Korle Bu. We are doing the teaching hospitals in the first phase, and we continue with the regional hospitals and the district hospitals. By year 3, I believe we will be working in the very marginal facilities, the CHIP compounds, and that will complete the whole process for digitization of the health sector. We are not only doing FODA without, we are not only doing paperless consultation and things like that, but even the hospitals, at the end of the process, we will not pay cash to any cashier sitting in the way. So the hospital will also become cashless. And this system will also prepare the hospital's claims for health insurance. And that will also facilitate and move forward some aspect of indebtedness in health insurance, so that claims will become more efficient and we'll get them earlier, and vetting will not become very cumbersome. So health insurance will begin again to look at how we can strengthen that area. Human resource. Since 2017, government has provided financial clearance for 54,892. So by close of this year, on our account, we will have employed 54,892,000 health professionals, including some service professionals who might not necessarily be health workers, who support health service delivery, like accountants, administrators, and all that. And that, I think, is a very big achievement. Majority of those cleared were outstanding from 2012 to 2016, including private trainees. You are all aware that there was a big embargo because of our IMF engagement, said that government could not recruit. So when we joined in 2017, based on promises from the president's campaign platforms, we were seeing massive new nurses qualified, those calling themselves bonded, and coalition of private nurses picketing the ministry almost every day. These days, when you come there, you wouldn't see red bands in green and white. They are all in the field working. Yesterday, somebody called me, and they're asking for money for accommodation, renting, Kumasi. They say, Nanado gives you a job, and the minister should pay rent for you. So that is the success story that we have got to. Again, to facilitate our progress in recruiting faster, the ministry has launched an electronic platform to facilitate recruitment and placement of staff at all health facilities. I wouldn't talk much on training allowances. Sometime last year, by December, we had the raise. But all that has been cleared. And as we speak, between January and March, we have got a warrant. So we are getting releases that will pay between January and March for nurse training allowances. So we have lived up to expectation, and we have actually also delivered on one of the campaign promises. Healthcare financing. All I will say is that health insurance has started working again. Why should I say so? Our key strategy to achieve financial access to healthcare is our national health insurance system. As a result of the efficiency gains, the authority is in a position to increase service tariffs by 20% this year. The new tariffs came into effect on 1st April 2019. Providers were complaining about what we pay them for seeing our registered patients. So we've managed to up our game and increased the rates and tariffs that they were charging for treating our patients by 20%, which is good news for quality healthcare. By close of June 2019, sub-district facilities and below will all have been paid fully to enhance our achievement of UHC. We concentrate in taking healthcare to the last mile, the last rural person. So the whole nation has actually strategized in developing CHIP compounds and health centers beyond district level. That is where close to about 80% of our people attend facilities in the first instance before they are referred. So we are working to the extent that by close of June this year, all facilities below district level will have been paid everything that health insurance owes them, and their bills will now be paid according to the law, 3 months in arrears. That is what the law says. I will make sure we live to this throughout, so that the bulk of us will have access to health care without financial barriers. Let me take you through a little bit of what has been done so far. Between 2017 and now, health insurance has paid claims, arrears, and new ones that were coming in, close to 2.2 billion Ghana cedi. 2017, 908 million claims paid. 2018, 1.028 billion claims paid. And 2019 so far, we have done 266 million, 0.8 million Ghana cedi. NHIA has rolled out electronic receipts of 43 district offices, and preparations are being made to roll out nationally. We identified a lot of inefficiencies within the administration of health insurance and our engagement with our service providers. So we mounted strategies to try to see how we can eliminate these inefficiencies, get our numbers more efficient, to try to remove fraudulent claims and check on how we can take away people who don't deserve to take anything from us. And in that process, we have done electronic receipting in 43 district offices. Monitoring reports indicate that these offices have improved tremendously in premium collection and accountability. Revenues have increased by 33% in the first 6 regions where we actually mounted this: Central, Western, Eastern, Volta, and OT regions, after the introduction of e-receipting. Then we started e-renewal. This has led to complete transformation of NHIS enrollment process. Our benefits include increased renewal numbers within 4 months of implementation. Revenue from e-renewal constitutes 41% of the first quarter 2019 revenues from registration and processing fees. Clinical audits. Strength of clinical audit has resulted in the recovery of 28.4 million for overbilling of claims. So in the past, some providers were overbilling us, and we didn't have efficient systems to vet, so we were just paying. Now we have mounted systems that is trying to eliminate, remove fraudulent claims from our system. Some of the innovations: a mobile renewal code *929# will check validity, benefit package, and medicines list. *842#, providers can check membership authentication for each visit, real-time data on utilization. So when you go to a facility now, and they take your card and they see you through, you can check how much they bill you, so that if you are claiming something different from NHIA, you, even the patient, can contest. So they are put on the drugs that they prescribed, and somebody told you that, "Madam, we don't have it here, you should go and buy." And you went to buy, and you know you bought, and then you check on what is there to be claimed, and that particular medication is on our list, then you prompt us, and we'll see what we can do with that provider. SMS feedback to members after every visit. You just press 2 if you did not visit. Be a citizen, not a spectator. So when we get involved, you will help us check providers that want to try to cheat the system. 63% of renewals through mobile phone for April 2019 alone. On average, weekly attendance has improved to 550,000 patients authenticated. So you see, health insurance has started working again. And if Nana Addo should go anywhere to say health insurance is working again, there is evidence amply demonstrating why we are saying so. Let me move to the last areas of infrastructure. We have mentioned that we continue to rehabilitate, refurbish, and expand our infrastructure. These are projects that are currently ongoing, for which funds have been approved and at various stages of execution. There are massive pictures. I think there is some little exhibition, and they are showing quite a number of these. I can't go through all of them. Probably during the exhibition section, you will see a lot of these. Unless, of course, if you have particular questions on some facilities that you want us to highlight, probably when I sit down, you mention, I'll go through my slides and tell you the exact stage where these things are. we're having some challenges with some of our projects. Some have come to a standstill, especially those with a particular contractor, NMS. Minister of Finance is insisting on value for money audit, because what we have come to realize is that they seem to have spent more than work that has been done. And our fear now is that the little money left will not be able to complete work that should be completed. So we wanted to find out what had gone wrong, to try to position ourselves to see how we can mobilize resources to complete the rest of them. We have come to the tail end of that exercise, and soon the contractor will mobilize to site with all our audit infractions being answered now, and then we can get through. Some places like, I can mention all of them here. I can remember Fomena, Kumau, the Kumasi one, and then a few ones. They were part of the package for Dodua, but these things never got done. We started working on them, and that is some we have had challenges with them. So we will finish them soon, before late. Facilities like WA and Medina I want to mention, because some people have become a little, how do I call it, apprehensive about whether we are completing them or not. These are scheduled to be completed by July and August 2019. WA especially, we were even scheduling going to commission WA in June, but a few pens after the inspection will mean that we have to push it forward a bit. So that will be commissioned in July. The Medina project will also be commissioned in August. I think that's about, these are the facilities that I said we have problems with. Can you move the slides forward? The Kumau one. Dodua is completed 100%. Abetifi 35% completion. Kumau 45% completion. Takrady European Housing 85% completion. Second D, Kansaurado 6% completion. Garu 3% completion. Fomena 72% completion. But we are sourcing new funding, and they will soon trigger the LCs that expired for work to be done immediately. We are not going to abandon these projects. We will continue to work on them. But I wanted to check on efficiency levels of utilization of monies that have been put into that area. Thank you very much.